Hi there, and welcome back to Health Made Easy. In this new series, we'll be taking a look at polycystic ovarian syndrome, also known as PCOS, and a holistic approach to managing it. This video was originally presented as a part of our Health Talk Sundays webinar and covers what a PCOS is, its impact on overall health, and how a holistic approach can make a huge difference. It is broken down into three parts, and this is part one of three.
Let's talk a little bit about what polycystic ovarian syndrome is, and it's also shortened as PCOS or PCOS, and so you might hear me use that abbreviation instead of calling out the entire name, but it's polycystic ovarian syndrome. And what really want to look at today is talk about why it is important. So what causes it, and what is it? What are the symptoms that persons usually experience, and really understanding that information is going to help when we're talking about how to actually manage it. So that's why I'm going through all that first before we actually go into the management part of where you saw the holistic approach. All right, so I'm seeing coming in the chat several persons I've heard it before. And that is so good because it is such an important thing to be aware of because it is a leading cause of infertility in women. And it affects 10% of women in Jamaica of childbearing age or the reproductive age. So it can be as young as even 11. That persons may even start presenting with some type of symptoms when they're starting their regular menses. Now, as common as it is, unfortunately, less than half of our population know that they have it. It's usually after trying to get pregnant for some time and the difficulty of getting pregnant, or maybe because of some problems with the period itself or the menses, where it becomes diagnosed. So we still have a lot of persons out there, unfortunately, who are suffering with it and don't know. Other things is that it is most commonly seen in persons who are overweight or obese. And one thing to note, it can happen in persons who are of a normal weight. It's just that it's a smaller percentage of those persons that tend to you see would have polycystic ovarian syndrome. Now, hear the word syndrome, it is something that can have serious consequences medically, affecting emotionally. Just being diagnosed with an illness overall is stressing enough. So again, but aside from that, it does have other emotional things and other stresses that it can cause, whether it's in the family or elsewhere, just personally, and also financial consequences. Because as you'll see in your presentation, several things can happen as a result of it, requiring several doctor visits, like different types of physicians, not just a regular. Not just like one or two specialists, but it can have several doctors that you have to go to. It also increases the risk for other diseases like diabetes, heart diseases, just like high cholesterol, for example. And if untreated, can lead to some serious consequences like cancer, what they call the endometrial cancer as well. So that's why it's so important to just get an idea of, to be aware of it. So in order to get checked out or if anything, so you can get a handle on it or start getting it managed as early as possible. Now, to get to the cause of it, it's not fully understood. They're still doing a lot of studies on it. But what they found is that genes do play a role. And you may have heard where different family members have it, they're suffering from it. Now, lifestyle factors also play a role in it as well. And what happens is that there's some hormonal imbalances and insulin resistance. What that insulin resistance means is, well, let's talk about insulin a little. So insulin is what breaks down the blood sugar levels, right? Kind of helps to lower it down. So, it's usually what we see in diabetes, more persons are common with insulin. And with insulin resistance, the body just doesn't respond to the insulin as properly as it should. So you might have high blood sugar levels, and you also have high levels of insulin, which cause a whole lot of problems, which we're going to go into in a little bit. So when we're talking about polycystic ovarian syndrome, we pretty much covered it as to what it is. So I'm just going to put it in like a little summary, a little simple terms, and we're going to go through the symptoms of it. Before, I want to show you what's normal from what's abnormal. So normally, we have this healthy ovary here that you're seeing here, and it usually produces like a nice little balance of hormones, both the female and male hormones, right? And as a result, it forms a mature proper egg that gets released to become a fertilizer and become pregnant. And if you're not become pregnant, you get your monthly period. That's what normally happens in a little nutshell or a little summary of it. Unfortunately, in PCOS, the ovary is producing excess male hormones, hence why we said hormonal imbalance earlier. And that excess hormone can disrupt ovulation, right? So the ovaries don't function as it should. Like the irregular periods, for example, can occur from it. The infertility, as mentioned, you might have polycystic ovaries as well. Little small sacs, like a balloon filled with water, multiple of them in the ovary. And some other symptoms you'll see because of that excess hormone. You may have experienced acne, right? You may see excess hair growth, whether it's on the face, the chest, the back. You may also have a hair thinning or male pattern baldness, that they call it, where you're losing some hair as well. And as mentioned before, infertility, pregnancy complications, low sex drive, stress, and depression.
Earlier, I mentioned that persons with PCOS can also experience insulin resistance, where there are problems responding or using the insulin properly, and that can lead to high blood sugar levels or uncontrolled blood sugar levels. And when your sugar levels are high for a long period of time, that can lead to type 2 diabetes, can also lead to weight gain and excess fat accumulating around the midsection, and can lead to something called abdominal obesity.
So a lot of things can happen. Again, heart disease like high cholesterol, and again, stress and depression can occur as well.
I've mentioned just a few of the key hormones that can be imbalanced in PCOS, but there are actually several others that can be affected as well. If you're interested in learning more about how different hormone imbalances impact health, check out the video Can Hormone Imbalance Affect Weight Loss, where I dive a little bit deeper into hormone imbalance.
So you can see it's a lot of things that's happening that can happen with just PCOS. And mention that it can, if untreated, can cause a higher risk for endometrial cancer itself. So even though I mentioned like the signs and symptoms of PCOS, the thing about it is that unfortunately it can present in a various combination for different persons. So therefore, and it can also present similarly to other illnesses, other diseases. So again, making it difficult to diagnose. When it comes to the management, which is where we're going on to now, the main part, the holistic part of it, it does intake taking a complete history, which is where the doctors always start with, where they're asking you so many questions. You're probably wondering why they're asking you all these questions. It's for good reason, because they want to know the family history. They want to talk to you about environmental exposures as well, which can also increase the risk or make you more susceptible to polycystic ovarian syndrome. Has anyone ever heard of BPA before, where they said, oh, stay away from BPA, look for BPA free? That's one of the things that studies have shown, that environmental toxin that can increase your risk for it as well. So they go through a whole lot of stuff in your history, asking a lot of questions. Then they do examination and investigation. So you'll see a lot of blood tests that they'll be doing and some imaging as well. And it's to make sure that they're trying to rule out certain things that can present similar, as mentioned before, while trying to decide if it is PCOS or not. We can move now to the management. And one thing to note though, it is an individualized approach, right? Because as I mentioned, persons will present differently, right? And so even if you realize that certain management might look alike, you may notice that there's some slight difference. So they really do make it individualized too, and that's why it's so crucial to stick with your healthcare providers to really get that one-on-one support. That wraps up part 1 of our PCOS series. In the next video, we'll be discussing holistic approaches to managing PCOS. So be sure to subscribe and turn on notifications so you don't miss it. See you in part 2.